Hi there, my name is Leah. I'm one of the lung transplant dietitians at Northwestern Medicine, and this presentation is on my research project evaluating the use of glucagon-like peptide 1 receptor agonist medications in potential lung transplant candidates that are requiring weight loss in order to qualify for transplant. So a little bit of background. Body mass index, or BMI, is one of the criteria that we use when evaluating patients for lung transplant. So per the International Society of Heart and Lung Transplant, a BMI above 30 is considered a relative contraindication, whereas a BMI above 35 is considered an absolute contraindication. At Northwestern, our criteria is that patients need to be under a BMI of 32 in order to qualify for transplant. So what this means is that many patients may require weight loss in order to be considered for transplant, which is one of the roles of our lung transplant dietitians. Glucagon-like peptide 1 receptor agonists, so you can think of these as like Ozempic and Wegovy are some brand names, have been traditionally used for type 2 diabetes, but have been showing promising results for promoting weight loss. But their specific utility has not been studied yet in the lung transplant patient population. So the purpose of this study was to evaluate the utility and safety of GLP-1 RAs in potential lung transplant candidates that are requiring weight loss in order to be considered for transplant. This was a retrospective study conducted at Northwestern Medicine and utilizing our EPIC medical records between May 2022 and October of 2023. Inclusion criteria consisted of any patients that were undergoing evaluation for lung transplant with a BMI over 32 and who at least met with the lung transplant dietitian 2 times within that study period. So we're actively working towards losing weight in order to qualify for transplant. A lot of different data points were collected, and these included primary diagnosis for transplant, weight trends, frequency of dietitian follow-ups, what their weight goals were, and if they achieved these weight goals, what medications were used, if any, the dosing, duration, and any side effects, among others. So for results, out of 61 patients who were evaluated in our RD-led weight management clinic, specifically for lung transplant patients, 42 of them met our inclusion criteria. The mean BMI at initial consult was about 36, and of the patients included, 50% of them were started on GLP-1 receptor agonists. And this was just determined based on the doctors if they thought it was appropriate to start the patients on the medication, as well as feasibility. So the mean percentage of body weight needed to be lost in the GLP-1 RA group was 12.4% compared to 9.7% in the non-GLP-1 group. In the GLP-1 group, 66.7% of patients achieved their weight goals compared to 52.4% in the non-GLP-1 group. And of the patients that achieved their weight goals, the GLP-1 RA group lost an average of 11.8% of body weight compared to only 5% in the non-GLP-1 group. And this was clinically significant. So both groups got dietitian counseling one-on-one, discussed weight changes, discussed any type of physical activity modifications that could be done. And then the major difference between the two groups was the use of the medications. The most common side effect for the patients on the GLP-1 medications was gastrointestinal distress. And the biggest barrier to initiating the medications was lack of insurance coverage or inability for the patients to pay the out-of-pocket costs associated with them. In conclusion, the use of GLP-1 RAs were shown to be useful in potential lung transplant candidates requiring weight loss, especially when looking at average body weight percentage that was lost. But additional research is needed looking at larger studies and prolonged follow-up periods to really determine the safety of the medications. And then our future research, specifically at Northwestern, we are looking to kind of expand on this and look at how body composition or fat-free muscle, kind of comparing muscle mass to fat mass and how that changes when patients are on the GLP-1 RAs compared to not on any weight loss medications. And then also just looking at outcomes after transplant for these patients that are transplanted after.